This is a birth reflection. I want to talk about birth complications. This year, I've been the doula, and I think it was 33 births this year. A few of those got complicated. Some of them were complicated during the labor. Some of them were complicated after the baby was out. Some of the top complications that I've seen this year have been a placental abruption, a couple of hemorrhages, postpartum hemorrhages, a few cord issues where the cord is wrapped around the baby's neck or the body. That alone isn't the complication. It usually is as the baby is descending into the pelvis, that cord is being crushed on a bone or on the baby's body, and that is what's causing the baby's heart rate to decel. Having the baby's cord wrapped around their neck is not a complication by itself. Don't let anybody lie to you. It is when that cord is compressed, and that is the complication. I think some of the best ways to avoid traumatic births. First of all, I don't think you can avoid a complication. Sometimes they're just going to happen. There is nothing you can do to avoid your body experiencing a placental abruption. There's nothing you can do. There is nothing you can do to avoid a postpartum hemorrhage. There are some risk factors that you can, keep in mind as you move through labor and delivery, but there's nothing to say, oh, you can avoid this postpartum hemorrhage. Sometimes they happen. The best way to handle complications, be educated about what they are. Know the things that happen. Know why they happen. Know if you do this, you are elevating your risk. For example, being on Pitocin for long periods of time elevates your risk for postpartum hemorrhage. That is one of the risk factors. There are others. Being educated about what's happening during labor and delivery. Another thing you can do is to make sure you are at a place that's going to listen to you. You are with providers that take you seriously, value you as a person, don't come with their own, their own bias about, your race, your profession, your income. Being at a place with professionals that will take your concerns seriously. Having someone in the room that is your advocate, that will remind you of, hey, remember we talked about that. We talked about how that drug isn't FDA approved, and that may not be the safest thing for you. And talking about, being able to talk with the providers like, I hear what you're saying, but we still have questions about this, and we'd like to move forward in another way. It is being comfortable in the space to not so much talk back, but be in open dialogue and not feel uncomfortable. Another way to prepare for complications. Be educated, have a good provider, have support. Those are the ways. Be educated, have good providers, have support. That way, when complications arise, you have someone who is experienced, who's on your side, that you can look at and go, is this normal? And if their face is, this is normal, everything is fine, or if their face is going, don't let them do that to you. Don't let them do that to you. You have someone in your back pocket that can assist you in that. I would prefer for all births to be uncomplicated. I would love that. I would love for everyone to be able to give birth to their babies and everybody go home together. But that is not always the deal. There are complications that happen, and you need to be in a place and a space and with the right people that can keep everybody safe and everybody can go home. Thanks for coming to my TED Talk.